Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, September 14th, 2020. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, Brad, thank you and good afternoon. I should say at the outset that today we are honoring our frontline healthcare workers, as we've tried to do often, but in particular we were asked by a number of these groups to proclaim today as Champions of Care Day. And it's a small way in which we can thank frontline healthcare workers such as nurses and paramedics and long-term care home staff for their unwavering dedication to saving lives and to keeping people safe, and for their heroic and unwavering response to the ongoing COVID-19 pandemic. And so we do extend our sincere gratitude to them, as we try to do each and every day. But frankly, the best way in which we can honor our frontline healthcare workers and honor our citizenship with each other is by making sure that we're doing everything we can to stop the spread of COVID-19. I know people are concerned about the number of new cases that we're seeing. I'm not just concerned about the rise in these numbers, I'm deeply concerned about it. Starting today and in coming days, Dr. de Villa will be providing some more details, as best one can, around the COVID-19 cases that we are seeing in our city and some of their root causes. I think this is important for the public to know how the virus is spreading in our community, and that our health officials provide as much detail as they possibly can in real time, knowing that you can't easily generalize about times and places, even if you can to a greater extent about behavior. This information will help us to make sure that we're focusing our efforts to stop the spread of the virus in the right places and in the right ways. And I believe by sharing it with the public, we are giving people facts that will help them to make the right decisions to protect their health and the health of their families. In the main, it has been repeated, and it bears endless repetition. We need everyone to continue to follow public health advice to help minimize the resurgence of COVID-19 in our city. We need everyone to wear a mask. We need everyone to wash their hands. We need everyone to keep their distance from each other. That's the simple advice. As I have canvassed experts on this, and I've made an effort even in the last 24 hours to talk to as many people as I could beyond the excellent advice I get on a continuous basis from our own Medical Officer of Health, people have said the main thing we have to focus on is to know the places and settings not to be in and the practices not to engage in, and then don't do them and stay away from those places. The bar that doesn't keep people seated should be following the rules, and that's their responsibility. And we're trying to enforce those rules as best we can. But the bottom line would be, if you see a bar that's a crowd scene like that where people aren't following the rules, stay away from that bar. The party bus shouldn't be operating as such, but if there is one, don't get on it, or if you're already on it and it starts to turn into a party scene and is overcrowded and people aren't following the rules, get off the bus. If a strip club somehow has found itself open under the rules as they exist, don't go there. If you're at a party and it's getting overcrowded and people are not wearing masks, then please leave. These are some actual examples of behaviors that we can influence the spread or the non-spread of this virus through our own personal behavior. And there are examples of things people have actually done that similarly boggle the mind but also operate as a lesson to all of us. We heard this morning, for example, on our command call we have each morning, about a case where a family got together with a relative to comfort them and support them, as you would expect, but they got together with a relative who they knew had COVID-19. And after they came back from that get-together, some of them ended up in Toronto testing positive for COVID-19. How does that make any sense? It's behavior like this that is leading the virus to continue to spread in our community. We do not want to go backwards. We do not want to have to go back into a further lockdown due to the thoughtless actions or people just not thinking about the basic advice that they've been given by our expert medical officers of health and by all of us as leaders. We made enough progress fighting COVID-19 through the spring and summer that we're able to move forward with the safe restart and reopening of our economy. But keeping it safe so we don't have to go backwards, requires not just leadership and rules from the Premier or the Mayor or the Medical Officer of Health or anybody in government officialdom. It requires common sense and compliance from individual people, every single one, without exception. Never has there been a more important example of the fact, and it is a fact, that you cannot legislate common sense. And yes, it's about health and saving lives most importantly, but it's also about saving jobs and businesses that we all rely on for our collective well-being. And that is why we created things like Active TO and Curb TO and Cafe TO to help businesses get through this and make summer more enjoyable for people during a pandemic. And that is why I've asked the city manager to look at how we can improve and expand those programs for next year. That is also why we launched Show Love TO this morning, so that we can give people ways to enjoy and to love their city, as I know they want to do, but to do it as safely as possible so that our economy can come back strong and so that people can recapture a bit of that joy about being a Torontonian. But we very much present all of these things within the context that people have to do whatever they have been advised to do in order to keep the city safe and healthy, while at the same time opening it up and bringing a bit of a sense of joy back to our lives after months of very miserable circumstances. So in thanking the vast majority of people who are behaving in a sensible and considerate manner, I also ask for your help. I plead for your help in assisting those who are not following the rules to get with the program. We can do better than this. We can do better than this. We've been doing okay, but we can do better than this. And in fact, the standard we should be setting is that we have to do better than this. It's not that complicated. It is a matter of life and death and health and respect and consideration for others. And as Torontonians, we're generally pretty good at that. On that note, I will ask Dr. de Villa for her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. Since our last report, we have continued to see a steady and worrisome increase in new COVID-19 infections in Toronto. Today, I'm reporting 264 new COVID-19 infections in our city. This is the number of new cases since Friday. It is not a single-day increase. This new count brings our total COVID-19 cases to 16,873. A total of 14,999 people have recovered from the virus. There are at present 25 people in hospital with COVID-19, and 5 people are in ICU. This is a noted change that our hospital partners have recently highlighted. Our focus must be on what each of us will do to reduce the risk of spread. Remember, these new infections I've just told you about occurred within the past couple of weeks, and there continues to be virus spread in our city. This means we should expect that our case count will go higher. I'll return to the numbers in a moment, but first I want to talk about the return to school. I know that there is unease. That's natural when doing something for the first time in a long time, and especially in our world with COVID. I've said that I'm certain there will be cases in our local schools. This isn't to say that schools will always be the source of the infection. But wherever it comes from, here's what will happen and what you will be told if there's a case of COVID-19 at your child's school. Typically, the first to know about a confirmed infection is the person who has the infection themselves, or in this case, their parent. COVID-19 test results are like any other medical information. They're private. But remember, if your child gets a positive test result, you must let the school know and keep your child at home in self-isolation. 3 things happen next. First, the school system will let my team at Toronto Public Health know about the case. Second, my team will call you soon after to help guide you through the coming days and weeks thereafter. We'll also ask for your help with the contact tracing process. This is so important to help limit the risk to other people. Contact tracing is the third part. We will make a quick decision about whether the facts indicate an infected student's class or cohort needs to be kept at home to self-isolate, and we will contact you if the decision applies to you and your child. All parents will be told if there is a confirmed case in their child's school. If your child is not part of an affected class or cohort, they can continue to go to school as usual, but you should monitor your child for any signs of illness. Remember, anyone who is at high risk is contacted first to get them into self-isolation and away from other people. So now, let's get back to the case count. Let me give you some examples of how and where we're seeing COVID infections in our city. So we know of a big family gathering where there was very little mask wearing and too much close contact. Our case investigators were told by those involved, we're family. We didn't think we could get this disease from each other. But of course, infections resulted. We also know of infection that resulted from a family trip, where part of the time was spent with a person confirmed to have COVID-19. And over the weekend, there were reports of a busy restaurant where a performer was moving from table to table, unmasked. It was noisy. People were close to each other and had to lean in and speak loudly in order to be heard. This is a situation where an asymptomatic carrier could easily spread infection to others. Here's what this information doesn't mean. It doesn't mean you can't spend time with family and friends. It doesn't mean you should stop going about your daily life. And it doesn't mean that one place is safe or that some other place isn't. It just doesn't work that way. Every place is a question of low, medium, and high risk, determined in part by what goes on there, and in a very big part by what steps for self-protection you take while you're there. So here's what this information does mean. It means that we can't tell who's got COVID and who doesn't just by looking at them. It means people aren't immune from COVID-19 because you're related to them or because they're your friend or your coworker and they don't look sick. It means if you have COVID-19, you should stay away from other people. You should isolate until a medical professional tells you you aren't infectious anymore. When I provided those examples, I bet you just said to yourself, well, I'd never do something like that. I bet the people in the examples thought the same thing. In some instances, I know they did. They said so. These aren't bad people. This is just human nature. We want to socialize, and we want to be together. We want to be close to one another, and we want to spend time with people we love. We want to believe that COVID-19 will only infect other people. But that's probably the biggest mistake we can make right now. We can't do many of the things we used to do right now. Not in the ways we used to, not in the ways we want to. This is hard to hear, and it's even harder to do. I get that. And I wish I could tell you otherwise. But the fact is, you need to know that where we go and what happens to us depends enormously on the choices we make. You are not powerless. You can protect yourself. You can protect others. You just can't act like nothing has changed. If you do, there's a real chance you're going to get sick or you're going to make somebody else sick. Your decisions and your choices are the most important part of living with COVID in our community. Last spring, it was easy. The vast majority of us stayed at home, apart. We saw what happened. COVID infections declined. But last spring was also really hard. There are hard costs to being kept apart. But it isn't the only way to fight back against COVID-19. The most powerful weapon in the fight against COVID-19 is you, the people of Toronto. And right now, we've got to come together again, just like we did last spring. Whatever you do that brings you into contact with others, ask yourself first, do I have to do this? If I do, am I taking the steps for self-protection that I advise each time I speak with you? Watching your distance, wearing your mask, and washing your hands. The current case count in Toronto is concerning. I'm asking everyone in our city to take a few simple steps for self-protection. Watch your distance, wear your mask, and wash your hands. I know some people find it hard to believe something so simple could make such a big difference. But I promise you, it's really true. If you're always taking these steps to protect yourself, logic dictates that we can gain control over our numbers and still live more freely than we did this past spring. These 3 steps for self-protection work together to create a powerful sequence of actions that reduce virus spread. And they really, really do work. I'll now turn it over to Chief Pegg for his remarks.
Thank you, Dr. de Villa, and good afternoon. More than 9 months ago, we began working with Dr. de Villa and Toronto Public Health in preparation for the impending arrival of the coronavirus. The evaluation and proactive planning for what would soon be known as COVID-19 was underway long before the first case was reported in Canada, let alone in Toronto. Since the arrival of the first case in Toronto, we have managed through the period of shutdown and into the phased reopening of many aspects of our city. Together, our city has built and continues to operate the largest incident management system in our history. Our Emergency Operations Center has operated continuously now for 188 days in response to COVID-19. Throughout our response to COVID-19, we have never wavered from our overarching goal of saving lives and preventing our healthcare system from becoming overwhelmed. From the outset, we have built and operated robust and scalable systems that have enabled our city to respond to the ever-changing realities of this pandemic. Since the beginning of this emergency in Toronto, the city's corporate leadership team has been hard at work, ensuring that we are able to deliver the services that our residents need and rely on each day. Over the past number of months, under the leadership of Deputy City Manager Tracy Cook, our teams have been hard at work, bringing city services back online, while also continuing to prepare for a potential resurgence of COVID-19 as we head into the fall and winter months. Today, I'm very proud of the fact that 94% of city services are operational, with 67% of those services operating remotely through enhanced technology. All essential and critical services have remained operational throughout the pandemic without interruption, and the handful of services that have not been restarted are those that would require in-person attendance and would necessitate opening our civic facilities to the public. More than 180 city services have moved through the Consolidated City Service Restart Roadmap process that we developed and implemented in May. Perhaps most importantly, the vast majority of our city services are now being operated in a manner that enables enhanced continuity of service in the event of a continued resurgence of COVID-19. It is with this mandate and focus in mind that I have now been asked to return to the position of COVID-19 Incident Commander. My focus will include continuing the proactive planning and preparation that has been underway throughout COVID-19. Our consolidated COVID-19 resurgence plans will guide the city's response moving forward. We will continue to manage the challenges that COVID-19 brings, including those relating to the global supply chain of personal protective equipment. As the resurgence situation develops, we will continue to take the actions necessary to save lives and to prevent the healthcare system from becoming overwhelmed. I would like to extend my thanks to Mayor Tory and Dr. de Villa and the city's senior leadership team for their continued trust and confidence in my ability to take on this important work once again. I would also like to acknowledge each and every resident and business owner who has accepted and abided by our advice and direction as we have worked together to beat COVID-19. I encourage everyone to continue to follow the advice of Toronto Public Health as we do all we can to minimize the resurgence of COVID-19 in our city. And finally, I would be remiss if I did not remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. We'll take questions in a moment. For reporters on the line, so you know, we have staff from Transportation Services, Shelters, Parks, Forestry and Recreation, Municipal Licensing and Standards, and Senior Services and Long-Term Care on the line, should you have specific questions for them. First question is to Sean Lathong from CTV News. Sean, go ahead, please.
Okay, thank you very much. This question is for Dr. de Villa regarding schools. As we're seeing numbers in Ontario go up, I was wondering what possibly would be a threshold for case count in schools for a school to be shut down or for all schools to be shut down.
So, Sean, I think when it comes to specific actions that are going to be taken or considered by public health, they always have to be informed by the best available evidence. And some of that is going to be premised on local data and case counts and the like. Some of this is going to be premised on other jurisdictions' experience, and some is going to be premised on what we know from the scientific literature. So there isn't a single number or indicator that will dictate a specific course of action. Rather, it's the sum total of what we're seeing in order to mitigate risk as much as possible. But when I think about what makes our schools successful, or what will make our schools most successful as we try to operate them for the first time with COVID-19 in our community, how do we do this in as safe a manner as possible? The best thing we can do as a community is to actually reduce the amount of virus spread that's happening writ large. The lower the level of virus transmission in our community, the more successful, the safer the school environment will be. I do expect that we will see cases in our school environment. The issue is, can we keep the levels in our community low enough to allow our schools to operate as safely as possible? It won't be, there is no magic, to make it zero, but how do we operate as safely as possible?
Okay, and one follow-up, Dr. de Villa. I was wondering, you sort of touched on it when you were talking about instructions to parents with regards to what public health will do. What advice do you have to parents? I mean, I know there are some in the GTA today who are learning that their school has cases of COVID-19. They may not have heard anything from the school or public health. What advice do you have for any parents who have found out that there is a COVID positive case at their school?
So as mentioned in the remarks, it is our intention to ensure that parents in a school community are aware of COVID-19 cases within their school community. And for those whose children are directly impacted, who have, are at risk for contact or exposure as a result of that identified case, we will work with that family to understand the circumstances of that case. And of course, we're working with the school and the school board as well to determine what the exposure was, who's at highest risk, and to make sure that those who are at highest risk, who are in that cohort who were exposed, are actually self-isolating until such time as we can, more fulsomely determine risk. But just because there's a case in a school, I think it's really important that we note that just because there's a case in a school doesn't mean that the case came from the school. And in fact, we've seen in a number of instances, not just, in Ontario, but beyond, that oftentimes it comes from elsewhere. It's from elsewhere in the community, and it just happens to be a young person who's school age. So it may not come from the school, and also, just because there's a case in your school community doesn't mean that every single child in that school is at risk. So if you're not notified by public health that there is a need for your child to stay home and self-isolate, we would have people say that continue to send your school as per normal, to send your child to school as per usual, and to monitor them carefully for signs and symptoms of illness, which is something that should be happening on a daily basis anyway.
Okay, thank you. We go next to Jennifer Pagliaro from the Toronto Star. Jen, go ahead, please.
Hey there. I wanted to ask the mayor and also Dr. de Villa. Mayor Tory, you mentioned, that you can't legislate common sense. It's true that if a strip club is open and someone wants to go there, that they're going to find their way there. But could the city not control, for example, the fact that the strip club is open? We've seen 2 outbreaks now, and I just wanted to ask what measures the city can take on its own without the province in order to stem this worrisome increase that Dr. de Villa mentioned.
Well, without singling out that particular instance, although it is one that's in the news because we've had not 1 but 2 outbreaks, it is the case that it's very odd in a way, and it's very contradictory in some respects to have theaters not open, for example, big and small, to have departments of government, as the chief mentioned, that are not open to serve people in person, to have business offices that are not open throughout the city because of a concern about the kind of contact people will come into with one another, and yet strip clubs somehow found themselves in a situation where they could be open under the rules. Again, it's one of these areas where the municipal ability on its own, the city's ability on its own to legislate such places closed is questionable in the absence of an individual premise acting in a way that is contrary to the rules, directly contrary to the rules. It's not by any means a black and white situation, and so the most effective kind of order that could be given to close these would come probably from the provincial level. But I guess suffice it to say that, again, we're looking at all of these different things, and I think Dr. de Villa is quite right in what she said, and I hope people pay attention to it. It's not so much that we can afford to blame any particular place, or category of places as being the one thing that's causing this to happen. First, we have to change human behavior, and secondly, we have to count on people in those different businesses to follow the rules. And clearly, in instances where there's an outbreak of this kind, often that has not been the case, either on the part of the business following the rules or on the part of the patrons following the common sense health advice they've been given.
Do you want to add to that, Doctor?
Sure, I can add just a little bit. I think the mayor has covered off all the key points, but it does really come down to the specific behaviors that occur within any given establishment. It's not about a particular establishment or type of establishment is safe and a certain other kind of establishment is by definition unsafe. It really does boil down to what is happening in the location, what behaviors people are adopting, and whether people are in fact doing the best they can to engage in those self-protection measures. Watching distance, wearing masks, washing their hands. And this applies to both staff and patrons of any business. Whether, staff and patrons actually follow those basic self-protection measures, both within the context of that business and beyond, that I think is what will go a long way towards addressing case counts in our city and reducing virus spread.
And just to follow up for Chief Pegg, welcome back, and perhaps Dr. de Villa, just on preparing for potential closures again as we seem to be in this second wave. I wonder what's changed from the experience of the emergency center in the first place. Are things easier now that you have an established protocol, and what plans are in place for us potentially going back to some elements of stage 2?
Yeah, thanks, Jen. I wouldn't necessarily say things are easier, but I would certainly say that as the response and planning to COVID-19 has continued, we certainly have a number of robust and comprehensive plans and processes in place. So for obvious reasons, unlike the commencement or the start of the COVID-19 pandemic, where we were reacting to things that were new and that we had never seen before, and we're having to develop all of those processes, the vast majority of those have already been built. We have very robust personal protective equipment management processes in place. I made reference in my note to a very comprehensive process that we referred to as the City Service Restart Roadmap process. So a number of things are in place. The work really has never stopped, certainly has never stopped. And over the past number of months, as well as throughout the incident, we have been planning nonstop for the eventuality of a resurgence, and that work will certainly continue as we're now seeing this uptick in cases.
Yeah, so I think the only other things I would add to that is that clearly we do know more about the virus now than we did several months ago. That's not to say that we know everything, but we certainly are better informed and have more evidence on which to base our actions. And I think importantly, I just can't say this enough. We know what works. We know that watching your distance works. We know that wearing your mask works, and we know that washing your hands works. These are all in our favor, and certainly a difference from where we were several months ago. I think another difference that's important to note, and one that I think we all need to work together on and support each other with, is the fact that we do have, and we've talked about this several times now at this table, some degree of COVID fatigue. Right? This has been very hard on all of us, keeping up with these measures and, having to do things differently from what we're used to doing and from what we want to do. So that's certainly a challenge, which is why, again, I appeal to all Torontonians. We are the greatest weapon against COVID-19 and in the fight against COVID-19. So to the extent that we're able to bolster each other and to make each other stronger, in terms of watching distance, wearing masks, and washing hands, I think that will see us in good stead.
Brad, I'd like to make one more comment on that, which is that I think we sometimes overlook the fact in trying to sort of figure out, and I think we try to figure it out for the best of reasons, whether it's bars or whether it's a certain kind of clubs or whether it's, party buses. We overlook the fact, and certainly when I met with my colleagues as mayors from across the GTHA today, there was a great point made of the fact that many of the instances that we're seeing of transmission are coming from private parties held in people's homes or from weddings and that kind of thing. And that is a much more difficult thing for anybody to regulate. In fact, there would be those who would argue you shouldn't be trying to tell people what to do on private property and this kind of thing beyond what presently exists as the rules about gathering size, which even apply theoretically to public gatherings. And so that is why it's so important for people's behavior, both in the context of the basic health advice that's been given throughout, wash your hands, face coverings, keep your distance, is so important because it is much more difficult and challenging to regulate private parties in people's homes. That can only be regulated by the people giving the parties and by the people attending the parties, or not.
Okay, thank you. We'll go next to Mark McAllister from City News. Mark, go ahead, please.
Thank you. To that point, both the points that Mayor Tory and Dr. de Villa have made about leaving it to individuals to try and make sure that they're doing this themselves and getting to a point where we're trying to overcome the next stage. To this point, you've said that there is a personal responsibility, but the last time we started on the upward trend of daily case counts, where we're at as of today, that is when the states of emergencies were declared, both at a provincial level and at a city level. So why do we not start moving back and start cutting the corners again in terms of trying to shut things down before it continues to climb further?
Well, I will simply start. I mean, first of all, I obviously rely on the advice of the health professionals, as I have and as we have throughout. But the bottom line is the state of emergency in the City of Toronto still exists. And so things that needed to be done could and would be done if the advice coming from the health professionals was such that there were specific measures that should be undertaken. And I can only say that, you know, the advice that's being given today based on the best possible evidence that we have is that the basic things that have been said throughout are the things that are going to probably make the biggest difference. But I wouldn't hesitate for a second if I got medical and scientific advice from this medical officer of health and from other people that we talk to and rely upon for advice in conjunction with the other governments to take whatever step was necessary to save lives and to protect health. That's what we did from the beginning, and it's what, of course, we will continue to do.
So further to that, as has always been the case, our actions are guided by evidence, whether we're looking at the local data or we're looking at the experiences of other jurisdictions or we're talking about what's in the scientific literature. So when we look at what happened several months ago in the first wave, if you will, of this particular pandemic, we actually didn't know as much about the virus. And going back to the question we just, the previous question, we actually know more about the virus now, and we know about what works. We have our own experiences. We have the experiences of other jurisdictions. And so at the end of the day, we know that physical distancing works, right? Watching your distance makes a difference. Wearing your mask makes a difference. Washing your hands makes a difference. So it's a question of, you know, trying to provide the circumstances, trying to encourage the kinds of behaviors that we know work, because we want to do things always within the context of public health, guided by the evidence, but in the least intrusive fashion possible. It's the, you know, balancing out what makes sense in order to control the spread of disease, while at the same time trying to ensure that we're able to enjoy as positive a quality of life as is possible. And we know that it is doable. It is doable if we actually all do our part in terms of adopting self-protection measures, because we know they work.
Just quickly to follow up on that, yes. This morning, Mayor Tory, you did announce the Show Love TO program. Is it based on this evidence and the knowledge that we have to this point that you feel comfortable to tell people to go out and enjoy the city rather than stay home at this point?
Well, consistent with what I've said all along, the last call that I made before I went to the announcement was to the medical officer of health, or we had a discussion about it this morning, because we have, this entire program has been developed. I would say that the lead on it has in fact been taken as to what's permissible and what isn't by Public Health Toronto. And so you'll note that the phases we announced today of the program, the first couple are all things that are happening out of doors. They're all things that are happening on a solitary or a couple of people out for a walk through a neighborhood, but we're giving them all the information about interesting things they can see to discover their own city. The art exhibitions and projections that are being held on a very frequent basis, so you will not get large crowds of people. You'll get small little knots of people. And of course, we're relying on people then to accompany that with the wearing of face coverings, the keeping of their distance, and the washing of their hands, the three basic things that have been mentioned over and over. So I'm entirely satisfied that the program is one that isn't completely consistent with both the desire, as Dr. de Villa said, to improve our quality of life to some extent and to bring a bit of joy back to the city, but to do it in a way that is consistent with public health. And should the program turn out, as I highly doubt would ever be the case given the nature of the program, to be causing any problems in that regard, I wouldn't hesitate for 1 second to change the program or otherwise make whatever modifications were necessary as advised by Dr. de Villa and her team.
If you don't mind, I'll just add a little piece to that and simply say this. It's not an either-or scenario. There is a way to actually manage ourselves responsibly, and that's what we're encouraging people to do by adopting those self-protection measures. We know that the risk is significantly lower when we talk about outdoor environments, so the risk of COVID-19 transmission. So, you know, simply, it's not an either-or scenario. It's how do we strike the right balance so that we're mitigating risk with respect to COVID-19 transmission, but also ensuring the broader health of the community. And yes, that talks about, having a strong economy, addressing mental health, and ensuring that we have, good or as good quality life as we can achieve under the current circumstances.
Okay, thank you. We go next to Mike Walker from CTV News. Go ahead, Mike.
Just want to follow up on Mark's question. With the anticipation that the number of confirmed cases will continue to increase, what's the threshold where we have to take a second look at maybe imposing more restrictions or taking a step back?
So I think those are excellent questions. And as I have indicated on a number of different occasions, there isn't a singular threshold. There isn't a single indicator. This is a far more complex situation than any one single indicator can point towards or guide us. And in fact, when you look at our monitoring dashboard, we have 4 different categories of indicators, each of which has a number of sub-indicators within them. These are the kinds of things that we're looking at because, yes, of course, we're concerned about virus spread and containment. We want to know what the day-over-day new case counts look like, how outbreaks are happening, what are our hospitalizations like. But we also want to understand, what is our testing capacity? How are our hospitals doing and how is public health doing in terms of its ability to respond? But suffice it to say that we still have a great deal of power that rests within our hands as a community. The more we actually pull together, the more we're able to do what we did in the spring, in the sense that we came together and we said, we're going to take these actions in order to reduce virus spread. I can't say it enough, right? Watch your distance, wear your mask, wash your hands. The more we're able to do that, the more likely we will be to be able to continue some of our activities, while at the same time still finding the way to live as safely as possible with COVID-19 in our midst.
Follow up, Mike?
Yeah. And it sounds like with the examples you gave today of these new cases since Friday, that a large amount appear to be from gatherings. Do you, know among the new cases, what percentage are young people? But because we're hearing from the data released by the province that nearly a majority of the cases do involve people under the age of 40. And secondly, Mayor Tory, in respects to these public establishments like the strip clubs, for example, would you be making any formal requests to the province to review the restrictions and the measures that are in place that may prohibit these places from staying open?
So I realize there was a question for the mayor there, but let me start off with the demographics. I'll be honest, I don't have the specific numbers on the demographic breakdown over the weekend, but I can tell you that over the last several weeks, it has been about 65% of our cases are amongst those under 40 years of age. So definitely a younger age demographic in respect of new cases in the last few weeks relative to what we saw earlier in the outbreak, say, for example, in the late winter and in the spring. So we're continuing to monitor that, and we're seeking to engage better with this population so as to try to ensure that they're adopting the self-protection actions of watching distance, wearing masks, and washing their hands. With respect to the locations, if I can just say a few words before the mayor speaks, I think the real issue is, right, what are the behaviors that are happening? What are the circumstances that people need to know about that give rise to COVID-19 transmission? We know what prevents it. It's the watching the distance, wearing masks, washing hands. What increases the risk is close contact with crowds, so lots of people, and especially closed spaces. These are the circumstances that give rise to COVID-19 transmission or enhance the risk for COVID-19 transmission. And those are the kinds of circumstances that we're asking people of all ages in our city to avoid.
I won't go much beyond that except to say that I think a couple of other things that I would want us to take into account. in looking at any question about any kind of establishment, because the fact is there have been establishments and buses and all kinds of things of all kinds that have been people that have perhaps been playing fast and loose with the rules, to say the least, that I think we have to look at the instance of repeated behavior and behavior patterns in either individual places or in a network of different kinds of establishments. And one other thing I would certainly want to look at is the amount of public resources that are required to be committed to following up when instances of this kind happen. Literally hundreds of people who we have to try and in some way get word out to or communicate with, or who are put at risk. And I think you have to look at that sort of thing. And you have to look at the inconsistency of situations where you have certain kinds of places that are closed, absolutely and completely closed, theaters and whatnot, and other kinds of places that are somehow open, and just look at the kind of risk reward and sort of say to yourself, why? And as long as I think you're asking those questions continuously, I agree with Dr. de Villa. You can't generalize about a particular kind of place. You have to more specifically identify people that are just not following the rules or encouraging the rules to be followed, including individual people.
Okay, we go next to Thalia Daragon-Giguère from Radio Canada. Go ahead, Thalia.
Hi, everyone. So my question is for Dr. de Villa. So regarding the second wave that we're expecting this fall, I was wondering if the increase in cases we're seeing right now is happening faster maybe than what you would have expected?
So first and foremost, I know that people are using the terminology second wave, but I'll be upfront and clear that I look at it as an increase in activity because we don't know. Nobody can really predict what form this new activity will take. Will it come in a single wave, or will it come in a series of smaller waves, or just come at a low, grumbly level that just continues throughout the fall and winter? Very, very difficult to characterize. So I just try to think of this as an increase in activity. With respect to whether I think it's going at a different pace, faster or slower for that matter, relative to what we thought, I actually think that when we look at our data, we had projected that there would be an increase in cases, based on the experiences of other jurisdictions, based on our understanding of how this virus moves through a population. I think we had said that as more people were out and about, interacting with each other, as there was more mixing and mingling between people, we had anticipated that there would be an increase in activity. And without getting into all the details of the numbers and how we look at how a virus spreads through a population, I think this is exactly what we had anticipated we might see, particularly as we are learning from other jurisdictions who are just a little bit ahead of us in terms of their outbreak curves and their experience with COVID-19.
Okay, thank you. And just as a follow-up, I know you don't really want to talk about the tendency numbers, but which kind of increase will make you consider to maybe lock down sectors of economy again?
I'm sorry, which kind of increase will
make you consider to lock down sectors of the economy again?
Well, this is an ongoing conversation that needs to occur between a series of partners. Certainly, we're having conversation here, and any decision, any action that is considered by public health officials, ourselves or those at the provincial or the federal level, should be based as part of public health practice on evidence, whether we're talking about local data, the experience of other jurisdictions, or what we see in the science. So right now, what's happening is that we're monitoring our numbers very carefully. It's not a single number. It is the sum total of all the indicators that we need to look at. And we also need to understand what sorts of success or lack of success has been seen in other jurisdictions in similar circumstances. Right now, we're having conversation with our provincial partners. We're having conversation with our federal partners, and I can tell you that there is a lot of active conversation amongst public health practitioners throughout the province, so that we can make sense of what's happening and come to the best decisions in order to mitigate risk as best as we can.
Okay, thank you. Final question is to Brian Passafium from the Toronto Sun. Go ahead, Brian.
Yeah, good afternoon, everybody. last, so all my questions have been answered, but I do have one. I'm asking this question on behalf of my colleague, Brian Lilly. Both the mayor and Dr. de Villa mentioned that bars and restaurants were largely responsible for the uptick in cases. Today, Premier Ford said he's hearing from public health departments that social gatherings were to blame. How do you respond to that?
So why don't I start off with that? I think social gatherings take many different forms. And in fact, I think the Premier makes a very good point. And it is perhaps a slightly different way or a particular set of words that says exactly what I've been saying here all along. It all comes down not to specific locations, but the kinds of behaviors that people engage in, right? We know what actually gives rise to COVID-19 transmission. We're more knowledgeable about that now than we were several months ago. So what we know is that when you have groups of people in close contact, and especially in closed spaces, without the use of self-protective measures, that's what gives rise to COVID-19. And that may occur in a variety of different settings. It's not uniquely or occurring within a particular setting. That's why I was saying that it's not to say that those settings are safe and these ones are unsafe. It actually all comes down to, what people are doing and how they're behaving within what kinds of contexts. And we know that what's really most risky, close contact, in crowds, in enclosed spaces. This is where COVID-19 transmission happens. So conversely, to put it in a positive way, what reduces the risk is physical distancing, watching your distance, wearing your masks, and washing your hands.
And Brian, I'll simply add to that the following, which is, I think we've tried in all of our comments. We tend to get more questions on bars and restaurants because there are thousands of them, and because we have some direct regulatory responsibility for them, and because they're public gathering places. But I think we've all tried to say, including today, and I gather including the Premier, that some of the other kinds of gatherings that are not as easily or at all regulated are making a contribution to this, and I could go on the list, because at different points of time we've talked about gatherings on beaches, we've talked about kids' play dates, we've talked about all kinds of different things, and the common denominator among all of them is personal behavior, because it's not necessarily the case that any of them need be a threat, any of those places or things, if people were wearing their mask, keeping their distance, and washing their hands, to look at the basic advice the doctors repeated a number of times today. So while we do end up spending more time sometimes talking about bars and restaurants, which undoubtedly can at certain times and in certain places make a contribution to this problem, it's not those places alone by any means. Never has been.
Okay, thank you. Brian indicated he did not have a follow-up, so that concludes today's briefing. We will be back here again on Wednesday at 2 p.m. Have a good afternoon, everybody. Thank you.